Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today I'm going to talk about 5 things that Medicare does not cover. And that's right, although Medicare is great, comprehensive insurance that covers a wide variety of services and procedures, it doesn't cover everything you might think it will for your healthcare needs. There's actually some pretty big categories that Medicare offers little to absolutely no coverage for. So it's really important to be aware of those before you start scheduling appointments, because you might end up paying completely out of pocket for some of these services and not have any idea beforehand. Before we get started, if you find the information in this video helpful, I'd appreciate it if you give it a thumbs up and subscribe and leave a comment down below. And we can get into exactly what Medicare covers, but like I said, more importantly, what Medicare does not cover. So when we look at original Medicare, that's going to be Medicare Part A and Medicare Part B. And I've got some more comprehensive videos that goes into exactly what's covered under Part A and exactly what's covered under Part B. But just kind of general rule of thumb, Medicare Part A is your hospital coverage, so it's typically considered your room and board in the hospital, so semi-private room, meals, nursing care, medications in the hospital. And then Medicare Part B is more your outpatient services. So these are going to be either medically necessary services or preventive services. So things like vaccinations and stopping things before they happen, as well as the medically necessary medical conditions. And some things in the hospital might fall under Medicare Part B. Like I said, I've got a video where I go a little bit more in depth explaining that, and I'll link it down below. But it's important to understand 2 big parts to original Medicare, Medicare Part A, Medicare Part B. Now, there's some things we might think are going to fall under Medicare Part B because we think they're medically necessary. However, Medicare does not, and therefore does not have coverage for these services. So the first big one, I kind of lumped them together: dental, vision, and hearing. So your routine dental care, things like cleanings, fillings, root canals, not covered under original Medicare. Routine vision, so things like eye exams, glasses, contacts, not covered under Medicare. And then routine hearing, so a hearing assessment and hearing aids, not covered under original Medicare. Now, there are a few, I guess you would say, exceptions to these. For instance, things like cataracts will be covered under vision, as well as dental. If you're hospitalized, you have like a facial tumor and needed reconstructive surgery, that kind of dental could be under original Medicare. But general rule of thumb is going to be any routine dental, vision, or hearing service will not be covered by Medicare Part A and Part B. Of course, there's outliers to that rule, like I said, but it's good to remember that for what most people think of as typical dental, vision, hearing services, not covered under original Medicare. You do have options to get these covered. You can get a standalone dental, vision, hearing plan. Typically, they're not terribly expensive. It's going to be a monthly premium with a benefit amount. You can have just a standalone dental or standalone vision. A lot of plans will link all 3 services together, or link at least 2 services together, like dental and vision, but they're a standalone separate plan aside from your Medicare. There's also something called a discount plan. So you can have a dental discount plan or a one of all 3, where it's not typical standard insurance. It's a plan you pay a pretty low annual premium for, and you get discounted services. So you're going to work with a network of providers, and you're going to have like pre-negotiated determined rates before you go in. So you know when you go get a filling, you're going to pay $65. It's all lined up as long as you use a network provider. Your other option would be possibly a Medicare Advantage plan. So kind of leaving original Medicare onto Medicare Advantage rather than original Medicare with a supplement. A lot of those Advantage plans do offer dental, vision, hearing benefits, but you want to really look at the benefits closely because A, you're going to be in network, and B, you want to also check the benefit level. Is it really worth it? You kind of have to weigh out your options, whether you'd rather do original Medicare and a supplement with a standalone dental, vision, hearing plan, or have that all-in-one inclusive plan, because there are pros and cons to either of those. And that's what I do. I work with people looking for Medicare supplement plans as well as the standalone dental, vision, hearing plans. So if you have questions about those, you can always give me a call. My number is 833-65-JAMIE, or you can visit my website, medicarebyjamie.com. Send you a free quote. There's no cost to work with me, and we can go over kind of the pros and cons of both options. The second thing a lot of people are surprised to find out that's not covered under original Medicare are your prescription medications. So prescription medications are covered under an aspect of Medicare, but not your traditional Medicare A and B. It's actually a completely separate part of Medicare called Medicare Part D. So Medicare Part D is an optional program to enroll in to get prescription coverage. So if you have Medicare A and B, you don't have to have Part D, but the majority of people are going to because it's going to cover your prescriptions. And these are prescriptions you pick up at the pharmacy. This doesn't count your prescriptions while hospitalized. But if you got any prescription, which the majority of seniors do, you're going to want a Part D plan to help cut some of those costs. And good thing to think about if you don't have any prescriptions when you first enroll in Medicare and you decide to decline the Part D plan, if you want one later, there's going to be a couple things to get through, like a late enrollment penalty, which is an accumulating penalty for the length of time you decline this plan, as well as time constraints as to when exactly you can pick up the Part D plan, because you can't just pick it up when you need it. You have to wait until the annual election period. I've got more videos where I go really in depth on Part D, and I will link those down below also. So that's going to be the most common way to get prescription coverage is Medicare Part D because it's involved in Medicare. But there are some other options too. Again, Medicare Advantage plans. So Medicare Advantage plans, the majority of them do include Part D coverage. So you're not going to have a separate standalone Part D plan. It's going to be tied into your Medicare Advantage plan. Again, there's a lot of things to consider with that. If your prescriptions fall into the formulary, what the co-insurances are, you want to do kind of a cost analysis to see what makes the most sense, especially if you take some really expensive medications. The other option is going to be kind of a prescription savings program. So a lot of people will use things like GoodRx or Blink. But again, it's important to understand that that does not count as credible coverage for skipping out on Part D. So if you decline Part D because you're using GoodRx and then you want to jump in Part D later, that GoodRx is not creditable insurance. So you're going to end up with that late penalty. You can have both though. So if you have a Part D plan, but one of your meds is cheaper with GoodRx, pick up the GoodRx too. Save yourself as much money as you can. There's no harm in having both. But if you're picking one or the other, Part D is going to be the one that's not having that late penalty. GoodRx, again, not credible insurance. A third thing that's not covered by original Medicare is long-term care. So it's kind of important to understand the difference between short-term care and long-term care. So say you're hospitalized and your doctor discharges you, but they don't want to send you home yet. You need some therapy, some rehab. Maybe you had a broken bone, something like that. You're going to go to a skilled nursing facility. Medicare is going to cover you for the first 20 days of that skilled nursing facility. And then after day 20, you have a co-payment or co-insurance. Now, something like a Medicare supplement plan would pick up that co-insurance until day 100, but you have co-insurance till then. That's still short-term care. Once you hit day 100 and past that, Medicare is not paying anymore. They say you've had enough short-term care. If you need more long-term care, that's a separate thing that we do not cover. So if you're going to essentially be living in one of these skilled facilities for an extended period of time, possibly the rest of your lifetime, that's long-term care, not covered by Medicare. The only real option you have for coverage of that is a long-term care insurance policy, but it's a little bit tricky because if you didn't get one when you're younger, they're more expensive as we're older. Obviously, the closer we get to needing one, the price goes up. So if you didn't get one in your 40s and 50s, now you want one in your 70s, it's probably not really that cost efficient, to be totally honest. It's going to be really expensive. And you realistically don't know if you need it. You know, if you're getting it when you need it, it's kind of too late to get it, unfortunately. Something else not covered by Medicare is foreign travel emergency. So being on Medicare, tons of people retired traveling. You want to see the world. You don't want to be stuck in just the 50 states. If you're going outside the U.S. and you have a hospitalization, say in Germany, it's not covered by Medicare. So your Medicare is great insurance in the U.S., not great insurance internationally. So you're going to be kind of stuck footing that bill on your own. So again, there are some options to help take care of this foreign travel emergency. The first one is to be a Medicare supplement plan. There are foreign travel emergency benefits. Typically, it's about a $50,000 limit on your foreign travel emergency. And you know that you can travel to other countries and not be totally concerned about if I have a major medical event, because we can't really predict those. The other thing is you can get a standalone travel insurance plan. Price on those is going to vary and it's going to depend on the level of coverage, deductible, all of that. So again, important to weigh those options to see which one's more cost efficient. And the last thing I'm going to mention that Medicare does not cover might seem kind of obvious, but I do get questions about this, and it's cosmetic surgery. So as we get older, we want to look younger, but Medicare is not going to pay for that because it's not medically necessary. So things like Botox, injections, lip, tuck, snip, all of that, unfortunately not covered by Medicare. Your only real option is to either pay for that out of pocket, so you can pay at the front. A lot of doctor's offices have plans, especially if you're getting something continuous, but not covered by Medicare, unfortunately. Hope you found the information in this video helpful. Like I said, it's really important to understand what Medicare does and does not cover, because you don't want to make an appointment, show up, and realize you're going to be footing this huge expense that you may not have planned on, because some of those costs can be really expensive when you get into it. So it's always important to weigh your options and see what kind of additional coverage options you might want to have to make sure that you're not paying everything out of pocket. Like I said, I work specifically with Medicare supplement plans. They're going to pick up some of those charges, as well as some standalone dental, vision, hearing plans. I'd be more than happy to work with you and answer your questions. Give me a call. My number is 833-65-JAMIE, or you can visit my website, medicarebyjamie.com. Even send me an email, jamie@medicarebyjamie.com. Make it real easy, Medicare by Jamie, easy to remember. I'd be happy to go over everything with you. If you found this information in this video helpful, I would really appreciate if you give the thumbs up and subscribe, and leave a comment down below. Let me know what questions you have about what is and isn't covered by Medicare, and I can also walk you through how to look up specific services to see if they're covered through the Medicare.gov website. It's a very easy service to use. Thanks so much for watching, and sorry for the delay on videos. I had a pretty good reason why though. Thanks.